Welcome back to the Daily Dope. Yeah, I'm your host and friendly commentator, Brand over here. And this is a part of a new series of clips that I'm going to be doing live. Hopefully they don't get too long, so we're going to go ahead and start it as soon as I can. Now, I'm going to go ahead and I have the chat open, so if somebody was to... Alright, that's back. I don't know if I'm streaming or not. Are you still there? Anybody out there? I don't know what just happened, but I just got a message that said I'm not streaming no more, but when I look at the program it says I am. And that's why I'm doing these things. I really don't know if I'm streaming or not, so I'm gonna check. That's crazy. Yeah, we might start this over. I might not even be going. It says I'm live. I'm still live. Hello? It says I'm live. All right. I'm still live. I just typed into the chat, so it looks like I'm still going. So that's why I'm doing this, guys, so I can figure this shit out. Now I got... This is terrible. Alright. So, let me just go ahead and get into it. This video may or may not stay on the channel, but anyway, we're gonna go ahead and proceed with this video. So let's just start out by watching this video, and then we'll go from there.
Opioid overdose visits to the ER.
New numbers out today show America's opioid crisis is getting worse. In 45 states, emergency room visits for opioid overdoses rose 30% in a year. Dean Reynolds has more on this.
According to the Centers for Disease Control, the nation is in the grip of a fast-moving epidemic for which there are no easy solutions. Illinois is one of the hardest-hit states with nearly a 66% increase in suspected opioid overdose visits to the ER last year. Dr. Tom Scaletta is an emergency room physician in Naperville, Illinois, where they treated 500 opioid-dependent patients last year.
You see the carfentanil and the fentanyl as well as heroin and...
Yep, we see a little bit of everything.
Increases in other states across the nation are even more alarming. Wisconsin up 108%, Pennsylvania 80%, Delaware almost 105%.
All right, now right off the bat, I mean, I know this clip might get long because I got a few stories around it, but the thing that I'm noticing right away with these numbers, and they're talking about a time period between July 2016 through September 2017. Okay, that's pretty recent. But one thing you can safely say about that time period for all these states where you've seen the highest spikes, Illinois, Pennsylvania, Delaware, and Wisconsin, is that none of them had a medical marijuana program to speak of. And if they did, access was bad, or we're talking about very limited, if anything, in the way of medical marijuana available. So just want to throw that in real quick.
In suspected overdoses treated in emergency rooms. Dr. Ann Schuchat is acting director of the CDC.
We saw increases in every geographic region, increases in men and women, increases in all adult age groups.
Can you hear me?
According to the CDC, overdoses kill about 5 people every hour across the U.S.
The potency and toxicity of what's on the street is very high right now. And so we think there probably is not an increase in people using drugs, but there's an increase in the danger associated with a single use.
Erin Weiner is the director of addiction services at Linden Oaks Behavioral Health.
We know that up to 90% of people will relapse in the first year going through rehab. It's a very difficult problem, and particularly for opioids, the biological pull is very strong.
Do you expect it to get worse? I hope not.
Based on what Trump's administration has done so far, and the people that they've put in charge of the crisis itself, and the overall drug war and what they're doing with that, there's nothing good that's just going to come out of that. All these numbers are going to go up. All this is going to get worse.
But there is little sign that the opioid epidemic is slowing down, and emergency rooms across the country are bracing for a night of frantic efforts to keep the victims alive. Jeff?
Dean Reynolds tonight, thank you.
So I didn't pull...
Late today, the president's...
I wasn't looking at this story, so we're not going to look at this story. But thanks for the quick update there, guys. I did pull this from The Guardian, so we can kind of zoom in on this story a little bit more. So the increase was roughly 30% across all U.S. states in just 14 months. This is a report by the Center for Disease Control. And like I've said in previous videos, that they have this methodology where they don't really get specific about what the overdose was caused by. They don't, they're not, if you died from some natural cause and you had a pill in your system, they might count that too. Interactions get counted for every drug that you died from or overdosed on would be counted, and interactions might be counted. So there's a whole bunch of things that the CDC does that's kind of iffy as far as like why they don't keep better records or whatever. But at the same time, they've always done it the same, so you can't look at the numbers and be like, oh, these numbers are fake because they don't do it right. Well, they've always not done it right, and the numbers are changing. They're going up, so there's something to say there. CDC called the data a wake-up call to the fast-moving opioid overdose epidemic. Recorded 142,000 overdose deaths, or overdoses, not deaths, in U.S. hospital emergency departments between July 2016 and September 2017. Although not all overdoses in the study were fatal, they are part of a grim toll opioids have taken. In the U.S. in 2016, illicit and prescription drug overdoses killed 64,000 people. We keep hearing that. And like I said, that number is a little iffy. But like I said, whatever that number is, it just represents where we are in this increase. I predict that the next time they put a number like that out, which is going to be for 2017, it's going to be in the 70,000s. And then when they put out 2018's numbers, it's going to be even higher than that. And I'm not being some kind of naysayer about this. I'm just saying that they have done absolutely nothing to address the systemic reasons for these overdoses. Back to the article. Our results through September 2017 show opioid overdoses are increasing across all regions, most states for most men and women, and most age groups, said Dr. Anna Shuchat, acting director of the CDC. We're currently seeing the highest overdose death rates ever recorded in the United States, she added. The infrastructure to fully tackle this problem is fragile. The CDC's Vital Signs study looked up 2 data sets. The first is the Enhanced State Opioid Overdose Surveillance Program, or ESOS, which is a snapshot of emergency department data from 16 states. 8 of those states saw substantial overdose increases of at least 25%. 2 states reported overdoses more than doubled, including in Wisconsin with 109% and Delaware 105%. I would like to see this data, and I probably will look at it a little bit closer later, of course, but I'm going to guarantee that everywhere where you've seen medical marijuana access was really good. What do we know about those areas? Well, we've heard many times that that's where you're going to find the overdose rates going down, and some cases up to 25%. Overdose rates, pills prescribed, overdose deaths, all those numbers go down in those states. So I'm curious as to why the CDC never mentions that. Furthermore, they do talk about harm reduction and all this other stuff down here. They're like, to curb the crisis, officials said communities would need more naloxone, which reverses overdose, better access to mental health services and medication-assisted addiction treatment. This is what I've been saying every time I do a new story about this. They keep pounding this to you, that they need to get more naloxone out there so you can hit people with that to keep them alive, and then usher them into a mental health services. What they call mental health services is some kind of mandated rehab, let's just face it. And then when you're talking about the rehab, then they're going to make you go to like NA, and then they're going to make you go to like the methadone clinic, or they're going to put you on Suboxone. Harm reduction programs to screen for injection drug associated diseases such as HIV or hepatitis C, and physicians to use prescription monitoring services. They're not serious enough about harm reduction programs, as I've also covered in other videos, because they don't want to talk about safe injection sites. They don't even want to talk about needle exchanges in some conservative areas. And it's funny because these conservative areas, like I said, they're getting hit the hardest. All right, Alabama, Mississippi, Missouri, and then West Virginia, Ohio, and basically the whole Bible Belt. And the thing is these, it's hard to say, but there's not always going to be a methadone clinic around there. And doctors are super conservative doctors. Sometimes these doctors in these areas don't want to prescribe, Suboxone. And then even worse than that, some of these sheriff's departments in some of these areas don't even want to have naloxone on deck. They're like, oh, you overdose in my county, you can just go ahead and die. And I've done stories about all those things. And it's not just one story about one situation. This shit's going on like that pretty much everywhere. So yeah, there's not much else to this story. The heroin and illicit drug supply has gotten even more dangerous than it used to be. And this is from the CDC director lady, adding that the drugs are so toxic that paramedics and police are at risk of poisoning themselves. And you heard that one guy earlier, he was talking about the carfentanil and the fentanyl. Yeah, man, they're bad. That's the situation, like I keep saying when I do reports about this. Not too many people actually bring that to the forefront. Like, a lot of these overdoses wouldn't have happened if it wasn't for patients with fentanyl or people getting fentanyl off the street. There's a lot of, and the thing about it is even when heroin is at its most potent, which that's another thing the lady from the CDC just pointed out, is that the heroin that's on the street these days, she said it, the heroin and illicit drug supply has gotten even more dangerous. She's just saying that the heroin is more potent on the street. Like, you get that shit, it's not like it used to be back in the even 90s or whatever. I don't know. You could argue that there's always been some really potent heroin out there, but it's so cheap and it's so flooding in from everywhere that the purity is high. And the fentanyl mixing with the heroin is still a problem. So all this stuff is like compounding the problem, and people get this wrong idea about it being like specifically a heroin problem, or yeah, you're adding all these things like the heroin with the regular pills that people take, the painkillers, and you're mixing that, not mixing them literally together, but mixing the statistics in with the fentanyl and the opiates, and you're just mixing all these statistics together to make it scare people. Well, it is. That's kind of what happens, and it's scary. Every one of those numbers are going up. The people dying from heroin, going up. People dying from synthetics, going up. People dying from non-synthetic opioids, like pills, going up. So, all right, that's that part of it. What about Illinois? Emergency rooms in Illinois, 66% spike. They have shit for marijuana legalization there. It's one of the states where you can get caught and get in the most trouble for marijuana, and they have the least ambitions towards legalizing it. So I don't know. I mean, I'm sorry, I was talking about Indiana there, but this is Illinois. So Illinois has a medical marijuana program, but it's a terrible medical marijuana program. Their medical marijuana program has lost a ton of money since it started, because one of the things I've always said about medical marijuana programs, they can really lose you some money if you don't allow people to buy smokable flower. And it's a big issue. So, but whatever, why even mention it? Because these guys aren't going to mention it. None of the articles I looked at. And let's just take a look. There was a lot of articles today about this specific situation. To be honest, this isn't the right one. This is just articles about this other thing that I found that has to do with that. But when you look at the articles that were written about this today, it was all mainstream media sources, and every one of them kind of had the same headline, you know, the spikes, the emergency rooms. And I kind of quickly browsed through them. They all did talk about, oh, the way we're going to solve it is this. And of course, it's always the more pills, more rehab, state sanctioned rehab, and just terrible. So anyway, yeah. So while that was, we had dueling articles that were, not articles, but dueling studies today about the opioid news. And all right, so I guess we dropped the connection there. I don't know, I hope not. If anybody's still here, let me know. Yeah, I don't know about this study that they're talking about here. It's kind of like, you might say it depends on the person, okay? They're saying that basically opioid patients had a little bit less stress overall than the patients that took basically over-the-counter painkillers. So, and there wasn't really a whole lot of things that they were talking about in this study that really made me think about it. Participants taking opioids were much more likely to report side effects caused by their drugs, the study showed, but there were no substantial difference in complications or drug-related ER visits or hospital admissions. Despite the potential addictiveness of the opioids, the study reported no incidence of patients in the opioid group developing addictions or trying to doctor shop to gain additional medicines. Now, even though that's true, I remember when I was on opioids from the VA, and the thing that I didn't like about them, it wasn't really necessary that I got addicted and wanted more of them and more. So that's the thing that they've always lied to us about addiction. They've always taught us or tried to brainwash us into this idea that addiction's this thing that turns you into this ravenous beast that has to have something more powerful and more of it. You know, like if you do a certain drug for a few days or something, I don't know what their deal is, you know, what their time frame is on this, but apparently you're going to need something more, and you're going to need something more powerful or more of them. Well, really, or even just like you're going to go doctor shopping so you can get more pills so that you can sell some to support your habit or whatever. I mean, it's kind of ridiculous because that's not how it works. But with me, I was on the opioids for pain, and basically it was like this thing where when I wake up in the morning, I really don't know if it was the pain itself because of the way I slept, because I slept good or something, but the pain was back right away. And there was also the sickness. Like if I didn't take the opioids, I couldn't really function too good. And I mean, I've heard a million people report on that. That's part of the thing about opioids, that most of the patients will steer away from it if offered an alternative that's, you know, not as addictive or habit forming. And when I say addictive, I don't mean you're going to turn into a ravenous beast and start running around looking for more opioids or stronger ones or whatever you want to call it. So I don't know. This study didn't really, it just made me like kind of think, you know, Jeff Sessions' rhetoric might be a little bit more than just rhetoric if there's a study that comes out, you know, take some aspirin. And another story that's kind of fallen by the wayside in all this opioid shit is this here. And this is happening to people all over. This happened to a couple friends of mine, a lady that was on opioids for 15, 20 years. And I mean, she was on 30 milligram Oxycontins, 2 a day, and she was fine. I mean, there was nothing wrong. She wasn't like nodded out all day or whatever. She needed it for the pain. And then one day the doctor just decided to cut her off. And there's a little more to the story, but I really don't want to expose any more of that story. But anyway, that's happening to a lot of pain patients, and there's no real explanation for that the doctor can give you to what you're going to go to. You know, everything they say, you're going to be like, yeah, I tried that. Oh yeah, that's not going to work. And it's frustrating. So I didn't read this article, and I don't think I'm gonna, but it's happening to a lot of people, man. The government is pushing. It's like they're pushing down, and whoever they're pushing against has to push down. We've already seen where the DEA is doing this thing where they can go around the Records Act. They're trying to go around the HIDA and look into where patients are going to too many doctors, or where doctors are getting too many prescriptions for one patient. And they're going to start going after these doctors and patients. And that's where we're at with this shit. And that's all I got on this story. I don't know how many people. There's 5 people hanging out maybe. So like I said, I don't really know what's going on with that either. Oops, I think I might have just moved it. Nope, that don't move. All right. But if anybody had anything more to add to that, and that's one of the things I'm going to do on these live clips as I make them, is I'm trying to get a little bit better at reading chats while I'm doing the clips, so I can kind of like comment on that or use what you're saying to help, you know, the story out. Because sometimes people that are watching these stories have a lot of personal experience with this shit themselves. And yeah, I feel sorry for this lady over here, because there's a lot of people like that right now, and there's not a lot of alternatives for somebody that's not willing to use medical marijuana, A, or B, she lives in Florida, so who knows if she can even get good medical marijuana. And if she can, if she has to go to the dispensary because she's able to get medical marijuana there, is it even going to be something she can afford? Or, you know, there's a lot of the reasons people are on all these pills. It's because they don't think medical marijuana is a choice, because it costs a lot of money to get medical marijuana. And quite frankly, some people are on fixed incomes, then they get their Medicare or Medicaid or whatever, and they get help with their meds. There's a lot of reasons, man, why people are pipelined into the pill regime of pain management. And especially in Florida. In Florida, they've been through some serious turmoil over the last few years. They had a situation where the pill mills were getting so out of control that people were dying of overdoses on Oxycontins and pills more than they were dying from heroin. And then it flipped around once they cracked down on the pill mills, and then everybody started going to the streets and getting heroin. And the heroin deaths started ballooning, and it surpassed everything. Meanwhile, the deaths that can be tied to fentanyl pretty much always stay neck and neck with both of those other numbers. So if anybody's been through the mill, it's pretty much Florida on all this stuff. These people can all tell you that they've all been through it before. Even the people that are getting cut off now, there's been other times when signals were sent out to doctors and they cut patients, and I've seen this happen to my own mom. And I know my mom isn't a drug addict or, you know, somebody that misuses her pills or whatever. And I know her doctor, who she's been going to most of her life or whatever, isn't gonna, like, you know, try to get her on some other weird shit or whatever. So a lot of this isn't the fault of the doctors and the patients, and a lot of the I don't know about blame, but in the misguided brutality of the drug war that Sessions is trying to roll out, yeah, it looks like they really are getting serious about trying to crack down on doctors and patients. So that's all I got, guys. I'm going to try to make these around 20 or 30 minutes, I'm sure. And as I do them in a more prime time situation where people can actually chat it up or whatever, so they might get interesting. I'll probably be doing these periodically between now and whenever I start going with the live weekly show. All right. See everybody next time, and thanks for tuning in, the all-nighters that have stopped by to see the show. And thanks again.